Welcome to Integrative Medicine with Dr. Leland Stillman, the podcast where we explore the best of East and West, old and new, conventional and unconventional, in search of answers to medicine's toughest cases and most difficult problems. This podcast is for informational purposes only. Diagnostics and therapeutics discussed on this podcast may or may not be right for you. So talk to a qualified practitioner before taking action based on what you learn here. If you'd like to become a patient at my practice, go to stillmanmd.com to schedule a complimentary discovery call. Thank you for listening and welcome to today's episode. Hello everyone, Dr. Stillman here. I am joined today by Magdalena and Dr. Mark Lewicki. Mark and Magdalena, thank you for joining me today.
Our pleasure.
Mark is a retired family physician, and he and his wife have recently started to use phototherapy. He has come out of retirement essentially to spread the good news about light being a powerful healing tool for all of us here in the modern world. And I like to start, Mark and Magdalena, by asking people who they are and where they're from.
Well, my name is Magdalena Lewicki, and I am originally, as my husband as well, we are originally from Poland, living in Canada, and then moving to Florida. So that's where we are from. I am a holistic practitioner. I do not practice right now, but I still kind of see people using now the phototherapy technology more than anything else. And I also do quantum healing hypnosis.
Fascinating. Mark.
And as my wife mentioned, I am a Toronto-trained MD. I did all my medical practice actually in Canada. I've been in a clinic rather for 29 years. I keep saying 30 years because it has a nice ring to it, but in reality it was 29 years. I retired in 2019 from active family practice, and this is a perfect opportunity to mention that had I known about LifeWave in 2019, I probably never would have retired. I'm just going to leave it at that.
Really? Great. So let's dive in. We're here today to talk about phototherapy, which you've already alluded to has had a profound impact on what you're both doing, and I think how it's safe to say, Magdalena. I don't know. Do you think you said you're not practicing, Magdalena, but you're still?
I still, because holistic approach to medicine, to healing, it's always been my passion. And, it's kind of ironic because my husband is a real deal. He is a Western trained doctor, and then here is me coming to his life and completely having an opposite way of thinking. So that was kind of interesting at the beginning because we, obviously I had my own ways of looking at things, and he had his different ways, the ways he was trained. So at the beginning was very interesting. We were still kind of not there together at the same.
There was some friction, let's put it that way.
Let's put it
That's
that
good.
way. But
It makes things better that way. You both
yes,
get
that's
better.
right. Oh, that definitely. But with time, as time went on, and I started studying more, taking different courses, and opening my eyes, and then talking to Mark, he kind of I could see the switch, the energy change a little bit. So he actually started implementing some stuff in his practice more and more and more, and that's when he actually became more successful. Well, what is successful in medical practice? I think that is when you get people on less drugs, on less medication, and they are actually in a better state before they come to him. And actually, as a matter, I can tell about Mark's practice, which I'm kind of proud of as well, because
Then don't steal my thunder. I'm going to mention that.
but I really love that fact. But okay, I'll leave it up to you to say that.
Basically, to continue along this line, when I started looking at some of the alternative approaches to medicine and started implementing that in my practice, I actually started seeing better results. I've actually started seeing improvement in patients' health. as opposed to just managing the condition. I've actually seen something that you could say patients have been cured, and that was again that was a bit of an eye opener and allowed
It's a
me to
teamwork, right?
sort of
It's a
correct
teamwork.
to look at different points of view, take the best out of what the modern medicine has to offer and what the alternative medicine has to offer, et cetera, et cetera. And as I mentioned before, back then, had we had LifeWave patches, or had I been aware of LifeWave patches, I probably never would have retired because of the profound health benefits that we're seeing nowadays since using this product for, in our case, less than a year.
But that's not what I want to say.
What she wanted to say is, I was in the clinic, I was in a clinic of 10 family physicians, and this basically was my only clinic I've ever worked in. So 29 years in the same location. So very established practice. I had over 2,000 patients in my practice. And the last several years, obviously, with all the EMR, electronic medical records, and pharmacies having access to, well, us having access to pretty much all the patient data, we could analyze all of our, and we have analyzed all of our physicians in the clinic. And my little claim to fame is that I had by far the oldest population of patients. And as traditional wisdom says, oldest patients require most medication. But actually, in my practice, despite having the oldest population by far, I prescribe by far the fewest drugs in the entire clinic. So, and this is not a random event, given that these patients, some of them have been with me for nearly 30 years. So this is something that I actually am proud of.
Well done.
See, that's a good
Yes,
one.
exactly the way medicine should be, and how they're trying to make it not. But that's a story for another day. So, how did you
Correct.
two find out about light therapy or phototherapy?
Well, it's a trio patient, Jovita, my friend, good friend. We know each other from Poland, and yes, it was kind of funny because she came to visit me, and I've noticed the patch on her back, and I actually did some reading about it before. I was aware of it, but never kind of clicked with me. I was actually aware about it for 2 years, but it's just didn't click. And then I saw it and like, you know what? That's it. I'm gonna read about it and I'm gonna order, try it, and that's when it all began. I kind of, when I heard that the stem cell word, that's what got me to it. So it really got me interested because, it just resonates with me. I know this is the future, and yeah, that's basically like that.
What was it that she said about the product that prompted you to try it or look deeper into it, other than just
Well,
stem cells?
honestly, this has been brewing in me for quite a while. It was just her because she's my good friend and I trust her. It kind of made seal the deal. Then, well, and then when started reading about it, that it's non-transdermal, it's natural, and anything that is natural like that, it just for me it's the most important thing. So then I kept on reading, and I really liked what I read about that. With the whole thing with copper peptide,
Hmm.
and how it's our own stem cell that being activated, reactivated. That's what really, really resonated with me because I know what it means to have a lot of stem cells, and that's what this patch does, help you to regenerate and to make them active again, and that means regeneration in all organs and everything else. So it wasn't that difficult really
What
to get
sorts
to know.
of challenges were the two of you looking to overcome with this product for yourself, your loved ones, or your friends?
Again, with my medical background, uh, I've realized a long time ago that you don't need to jump up and down and force anybody to take a medication or use a product, etc. Our job as practitioners is really to educate in my case, patients or clients and friends. We educate them. And really it's up to them. We need to lead by example, of course, always, but it's up to an individual whether they decide to use a product or not. To me, it's a very straightforward process, and I don't try and force anybody. I don't try to force them, oh, this is a great business, etc. We focus very much on the health aspect of things, and and again, I've come on board only fairly recently because I'm a skeptical patient by nature, person by nature,
Hmm.
and on top
Very
of that,
much.
with this many years of medical experience and seeing so many different products launched by the industry that after a year or so on the market or less, they have been pulled from the market because either they were not effective or they had major side effects, et cetera, et cetera. Obviously, I look at everything that comes my way with basically like objective skepticism, I would say. And we started using this product at the beginning of September last year. And for the first 4 or 5 months, because we have fortunately no health issues, nothing. So it's like, you're trying to improve on perfection, or close to
Well, let's be
perfection.
fair. You're not 20,
Correct,
so you
correct.
don't recover the way you used to. You don't have the energy you used to. You probably don't sleep as soundly as you used to, and you probably
True.
can't, you know, drink as much, exert yourself as much, jump as high, run as fast.
So here's that is correct. That is correct. But because there isn't a drastic change, I had to wait 4 or 5 months to really see if this is going to make a difference in me. So,
Yes.
uh, on a personal note, my hobby is golf. I really enjoy golfing, and for the longest time, and I've been golfing for over 40 years, even when I was a lot younger, if I played 18 holes of golf, then I would not really be able to play the following day because my body would be achy, I would feel tired, and if I went the next day, my score would be significantly worse. That's always been the
True.
pattern, and I can tell you, and I've been monitoring this. It just so happened that last few months, I've had a bit more free time, and I've been able to golf 5, 6 times a week without any negative stuff the following day. And the only thing that has changed is the patch. And I'm thinking, wow, that definitely, and that's when I started noticing that after being on the patch for about 4 or 5 months. In fact, I would come from a round of golf and I'd be
Big.
ready for another 18 holes. It's just run
It's
out of daylight. That is one of the first things that was a significant turning point in my acceptance of the product and its potential results.
Yeah, I have to say, I've been trying him to take different supplements in the past. Oh, it's so difficult to get him on a regular basis every morning. No, there's
There's
Mark,
women
did you
all over the world right now nodding along with you.
Yes. So with patches, whew,
This is the first product,
he just Magda,
honestly,
where are the patches? Where
every
every morning.
every
So
morning without fail. And this actually surprised me. I've got a good sense of, like we all do, what's good for me, what's not good for me.
Hmm.
The supplements, I'm sure they are good for me, but that sense never kicked in. With the patches, it's actually almost funny how, like, don't forget to put the patch on. Don't forget to. So I haven't. I might have in the last 8 months missed one day. That's correct, and that blows my mind
it
actually as
makes
well.
my job easy. So I don't have to run after him and just,
Definitely
remind
not.
him.
Definitely not.
You're reminding me to put my patches on. I had a busy
Oh,
There
morning.
you
there.
go. You're
We have
welcome.
a 4-month-old. He distracts me sometimes from getting the
Oh,
patches.
you have a
Correct.
good reason. Yeah. Did you put your patches on too?
I had one for 24 hours last night.
Oh, that's
That's
right.
right.
So today
Yes,
is a
we're
day off.
gonna take a
So,
break.
Magdalena, how about you?
How about you, honey?
About me, about
Your experience with the patches.
my experience. Oh, like definitely the way. Okay, my probably biggest thing is just being uplifted, happy, and motivated. That's basically for me. That's the biggest because I can see the difference when I'm doing things. I am a Gemini, so I tend to, start things and not to finish them, and
Hmm.
it's just nature of me. Uh, Here, I am really motivated. I am like something is pushing me from, like Magda, don't just keep
Are
going,
you more
keep going.
focused?
More focused. Yes, that's right.
Excellent. Excellent.
So that this is big deal for me. Other than that, the energy is great. My mom just gave me a call a few days ago because she's been patching for 5 months now, I
So
think.
can I take over, steal your
Y-
thunder? Is that okay? Because I'm
y-
going to use some medical terminology here.
Oh,
And
So
okay,
about
exciting.
about
exciting.
6 years ago, she had aortic stenosis,
Mm.
so she needed aortic valve replacement, which she did, and she's had annual follow-ups with
Mm-hmm,
echocardiograms, etc.
mm-hmm.
And she was stable. She just had a follow-up, annual follow-up last week, and she had an echocardiogram, and her cardiologist says, I can't believe it. Your numbers are so much better. I haven't seen the echo report, so I can't tell you what the flow is,
But he
what there is.
was
But the cardiologist
shocked.
was
He was
shocked,
shocked.
and
The
really the only thing that there's been no diet change, there's been no
Oh
weight change,
no,
no
there's
medication change. It's not like someone added a
but
beta
she's
blocker, etc.
76 too, so she's not getting younger.
The only
But
All
thing
she is.
downhill from
But
76.
she is.
The only thing that has changed is since November, she's been using the patches, and she basically was so ecstatic that she
Hmm.
gave us a call 7:30 our time, that she normally never calls this early, 7:30
Yeah, I
a.m.
thought something happened, but
And she
something
just
happened.
wanted to announce how well she's done during her annual
Is
Hmm.
cardiology
she in
checkup.
Poland?
Yes.
Yes.
Okay. So, what sort of symptoms or challenges was she facing in her life because of the valve or the heart disease she's had?
Prior to the replacement, again, it's shortness of breath with any exertion because the
Hmm.
aortic stenosis was getting worse and worse, and weakness, basically generous weakness.
Hmm.
Since the surgery, she's been doing fine, really fine. Uh, this is more, so I can't. We're actually flying there in 3 weeks, so I'm going to have a chance to talk to her more about her
Right.
symptoms. We haven't seen her physically since November,
But she's super energetic.
but
Like
yeah,
I said, she's 76. She takes care of my dad. She runs business. She runs the household. She cooks 3 times a day, cleans the house. So she has like, how did I prepare the Easter dinner? And it's not like here. It's not like 3 courses here. They make like 15
20
courses there.
or 20, yeah.
So you and she did all that. She said, Magda, I don't even know how I've done it and when I've done it. So her energy levels are definitely up, and it's exciting. It's very exciting. Like literally, she said, "My heart is getting younger."
And it's not just a heart. It's interesting concept. I've got the sense, uh, since being on the patches, I truly have the sense that our system, our bodies are regenerating. That really there
Hmm.
is a physical rejuvenation going on in our bodies, and that actually is very exciting,
That's
because
right.
of the way we feel.
Hmm.
Again, increased energy. Me being able to golf 5, 6 times a week without any difficulty, without breaking a sweat, literally. That is, I mean, going back 30 years, I could not have done that. So
Well,
that just is one of those little.
talking about stamina, because I've been always a party pooper when it comes to riding a bicycle.
Hmm.
So we go, 4 of us, me, my husband, and our 2 daughters, to ride a bicycle. That was like about 2 months ago. And wow, I couldn't believe like we were riding for an hour and I was speeding and the girls couldn't keep up with me. And I'm like, what is going on?
Correct.
Because normally, like you ask him, I could never, like,
Correct.
let's go home. I don't feel strong. I want to go home. Not anymore. So that's definitely the stamina. There's something
Correct.
going on. And I'm not an like a athlete that exercises. Well, I do exercise every day, but I am not performing. I am not biking professional or anything. But I see the difference still. So that's my little testimonial here. And I have many. It's just they're little, not as significant as my mom's. I think that's
Well,
pretty.
we can mention my mother as well. My mother is 81 years old, and
And that's great.
she's a very stoic individual, really stoic. She does not dispense praise to herself or anybody easily, let's put it that way. And she's been having issues with bilateral shoulder arthritis and pain, discomfort. She described this as 7 out of 10. But she would not take any pain medication, no codeine pills, nothing.
She's
Again,
tough.
she's tough, but she suffered. She had a hard time with sleep, etc., etc.
She will complain though
Uh,
about the pain and
Discomfort.
yes, discomfort,
So
discomfort.
about I think about 3 months ago, we said, "Mom, try the patches." So she did. And then I think we gave her a 2 week supply. She's up in Canada, so we gave her 2 weeks worth of patches through somebody. And you know, never had any feedback from her. About a month later, I talked to her several times a week, but she never mentioned anything about the patches. So about a month later, I say, "Mom, by the way, did you find the patches effective?" "Oh yeah, they were amazing." She says, "My pain went down to like
Serious.
2 out of 10. I could sleep well, and I've had no issues." I say, "And you ran out of patches?" "Oh yeah, I ran out a couple of weeks ago." "Well, why didn't you mention?" "Oh, I didn't want to bug you guys. This is my mother."
Of course.
So we got her set up. She's getting the patches now,
She
and
loves it.
she loves being on the patch. She says not only is her shoulder pain completely under control, she says it's made her so much more
At
at
ease,
ease
yes.
dealing with your everyday life routine. She sleeps better. So it's like, wow. And again, this is the skeptical me. Not only am I getting results on myself, I don't have to read on the internet, watch any YouTube videos. I have the people that are nearest and dearest to me having such positive effects that I've opened up, and I just, like I said, mentioned
Well,
recently.
couple days ago, or no, that was yesterday when you put couple. I
That was a
actually put
that was a
patches for your head, for your stiff neck
that
and blocked ear. Actually, this is interesting story because I saw at night before, Renita, she posted a little advice on patches, how to put them for the GB20. There are 2 points right here, the acupuncture points.
occipital tuberosity area,
And basically this is for the from
neck pain, and
for neck pain, for a cold, flus. Well, just I took a picture of it. Next day, Mark is telling me, "Oh, I have a stiff neck and my ear blocked." Perfect. Let's try the GB20 thing, and we did, and it was
15 minutes. We put
15
an
minutes.
energy patch on, and
The
as
the
well as
ear unblocked
I've
completely.
had issues for the longest time where occasionally it's like someone puts cotton in the ear when I have a cold. And I picked up a bit of a virus 2 days ago,
Which is
and
gone
which
right now.
2 days, I mean, this is day 3, which normally a virus will last, a cold will last a full week. This is day 3, and I'm symptom free. And yesterday, when I was starting to get that discomfort, neck discomfort and the ear discomfort, within 15 minutes, and it's like, wow. So
So
I'm
we
getting more and more of those absolutely
not a
amazing
skeptic anymore.
amazing results with the patches. Yes.
I actually have one more testimonial, which is quite amazing. Can I share or
We've
no?
we've only got a
Not
couple
to.
minutes left.
Okay.
So maybe next time.
Next
We
time.
do need to have a part two where we reconvene
Sure.
after you go to Poland and chat with your mother, and we'll hear some more stories. And I'm so glad that you
Yes,
guys have
yes.
discovered the patches and are seeing such great results. Any last words of wisdom, advice, thoughts for people listening?
The most important thing is that the health benefits appear to be very real, and the passion that is getting ignited in me is because of the potential effect. I truly believe that there is a good chance that at some point, vast majority of people on this planet are going to be using the patches. That may be an overly dramatic statement, but I truly am sensing that that may actually happen.
I have little advice for people because this is an amazing technology. This is something that never been in a healing field like that. So I just want people to know because there's a lot of people that the concept of the way it's sold, it gets in a way, and people do not get that opportunity to experience something amazing because of the silliness. And I said, don't be silly. Just really get over that and get it for yourself. You don't have to be selling it. You don't have to be a brand partner or anything like that. Just do it for yourself. You own it to you and to your family. Like, and I'm truly saying that from my heart, to go and get those patches like yesterday.
Thank you both so much for joining me today. It's great to see you both. We'll chat again soon,
Pleasure
I'm
Thank you.
sure.
talking to you.
People
Thank you.
can try the patches. There will be a link below this wherever you're watching or listening, Spotify, Apple, Substack, YouTube, wherever this is. Thanks again. Take care, everyone. Have a great day.
Thank you.
See ya.